This project is about the eClinicalWorks false claims lawsuit. On May 1, 2015, in the District of Vermont, Brendan Delaney filed a lawsuit under the whistleblower provisions of the False Claims Act. On May 31, 2017, eClinicalWorks agreed to a settlement of $155 million. Delaney and the government alleged that eClinicalWorks had lied in order to get its electronic health record, or EHR, certification, and had paid illegal kickbacks to companies to advertise their product. The lawsuit was taken over by the government and ended with eClinicalWorks agreeing to pay the fine and entering into a corporate integrity agreement with the U.S. Department of Health and Human Services, Office of Inspector General. On February 17, 2009, the government enacted a policy in which they would pay healthcare providers incentives to demonstrate meaningful use of EHR technology. However, this meaningful use was only valid if the EHR software was approved by a certifying entity that had previously been approved by the HHS. Meaningful use is considered legitimate only if the EHR system in question comes from a certified company and if they can show that its use contributes to performance goals relating to the product. The certification test is not really as rigorous as one would think it would be. A company looking to get their EHR system certified submits to the certifying entity what qualifications for certification their product should be able to meet from a list. The software is then tested only on the criteria that the company claims their product will be able to perform at. The certification body uses standard test scripts that are available to vendors before they are tested. A press release from the government states that certification testing does not confirm that each criteria and standard is satisfied in full and under every conceivable scenario. Rather, testing takes a snapshot of a product's capabilities and ensures it can pass certain predisclosed test cases. In 2010, Brendan Delaney, a former British cop, started working for the New York City Department of Health and Mental Hygiene. He was in charge of converting the paper records for the patients at Rikers Island into electronic ones. He noticed a lot of issues and deficiencies with the software. Some patients were listed in the same record, some medications were misprescribed, and some lab orders would be placed but were never processed. Delaney feared that these issues would lead to the death of a patient, and he decided to blow the whistle. When he first brought the issue up to his managers, none of them wanted to do anything about it. Even as he went higher up, no one seemed to want to take any notice. Eventually, he gathered his evidence and took his case to the law firm Phillips & Cohen. They made their case in the District of Vermont. The government ended up joining the lawsuit and added their own charges. eClinicalWorks was founded in 1999. Its headquarters is in Massachusetts. eClinicalWorks was founded by Girish Navani, the Chief Executive Officer, Rajesh Jarampuria, the Chief Medical Officer, and Mahesh Navani, the Chief Operating Officer. According to its website, eClinicalWorks' software is used by more than 850,000 users across the United States. Delaney's original case alleged that the deficiencies with eClinicalWorks rendered it ineligible for incentive payments related to meaningful use. The government joined the lawsuit with a complaint that eClinicalWorks lied about the capabilities of their product to meet government and electronic health record standards. They took advantage of the testing script and found ways to work around it so that their product appeared to work even though it actually didn't. They failed to adequately test their product before it was released. There were numerous bugs that existed in their software even as it was released to the customers. They ignored critical and urgent problems and bugs for months or even years at a time. When a bug was found and reported, they would claim that they would get around to fixing it, but they never followed through. They failed to satisfy data portability requirements. For example, eClinicalWorks did not have the capability to do a batch export, which would allow the user to export patient data in one action. They failed audit log requirements, which keep a record of the activity and chronology of patient care. They failed to reliably record diagnostic imaging orders. In certain scenarios, when an order was placed, it would only show up in one specific section of the record and not in a place where the doctor could see it if it needed to be followed up on. They failed to reliably perform drug interaction checks. If a doctor went to customize the prescription for the patient, it would cause the drug interaction check not to initiate. And they paid kickbacks totaling at least $392,000 to customers who would recommend their products. The lawsuit was settled with eClinicalWorks and its executives paying $155 million and entering into a corporate integrity agreement with the HHS Office of Inspector General. The founders Girish, Rajesh, and Mahesh were responsible for paying $154.92 million, while the developer Jagan Vithalingam has to pay $50,000, and the project manager Brian Secura and Robert Lyons were responsible for $15,000 each. Out of the $155 million that eClinicalWorks paid, Delaney received $30 million because he was the whistleblower. The corporate integrity agreement required eClinical to fix their software and have another approved entity assess their system, as well as regularly reporting to the Office of Inspector General. They were also required to compensate their clients through one of two methods. The first option was that they had to provide all of their clients with the means to move their data to a different EHR company free of charge. For the clients who chose to stay with them, they were required to provide a free upgrade to their latest software that actually works. The legal issue here is obviously that eClinicalWorks lied about the capabilities of their software when they were presenting it for examination. They knowingly took advantage of the test script so that they could make it appear like their product was working even when it wasn't, and they didn't let their customers know about the deficiencies with their product. The test script for RxNorm vocabulary, which is what they use for prescriptions, is what tested the software's ability to read the codes, but instead of coding their product to be able to access the complete database, they only hard-coded the 16 drugs they knew they would be tested on. When they transmitted the prescriptions, it also wouldn't transmit them in RxNorm codes. They didn't test their code before they released it, they just waited for their clients to report the bugs, but even when they were reported, they would ignore them. They paid money to clients with significant influence who would advertise their product. At one point it seemed that the deficiencies with eClinicalWorks software led to the death of a woman suffering from a brain aneurysm. Upon investigation, it was found that the doctor had suspected an aneurysm and had ordered a test that would have detected it, but the order for the test never registered. Unfortunately, it was never left to a court to decide whether eClinicalWorks was responsible for this, as the case was dropped shortly after the settlement. Another issue exists in the fact that the testing wasn't thorough enough to detect the fact that eClinicalWorks did not have a functioning software. The test was only supposed to get a snapshot of how the product worked, but even with all of the bugs existing in eClinicalWorks software, the test wasn't able to detect any problems. Many aspects of the testing process allowed eClinicalWorks to take advantage of it. The fact that they had the opportunity to choose what they would be tested on, and the fact that they knew exactly how they would be tested, contributed to eClinicalWorks tricking the test. On top of that, there were checkup tests that were conducted after eClinicalWorks received its certification, but they were the exact same tests that eClinicalWorks had been tested on the first time. Along with the lax testing, the climate for the transition to electronic health records was very rushed. When the government announced that it would be giving incentives to offices that used electronic health records, there was a rush for companies to output a product as soon as possible in order to not lose out on customers. This hurried attitude explains why eClinicalWorks was in such a hurry to put out a product that wasn't even functioning. Part of the corporate integrity agreement involved eClinicalWorks providing their clients with either new working software or with the ability to switch to another EHR company free of charge. eClinicalWorks claimed to be following the agreement they settled with, but certain companies are saying that they are essentially holding their information hostage so that they don't have the ability to switch to a different electronic health records company. While they provided a free option for transporting data, it's unencrypted, but if the customers want any higher quality transfer, they have to pay $500 or more. They also take roughly 4 to 6 weeks to transfer the data, so that's 4 to 6 weeks where the doctor would be without the ability to use the records. On top of that, eClinicalWorks still charges the full price for using their product until the data has been completely transferred over. Most other companies have a glide-off option that allows doctors to transfer the records and still use them while they're being transferred by paying a reduced fee to access them. Some offices are hoping that the government steps back in to force eClinicalWorks to better comply with the corporate integrity agreement that they agreed to in the first place. The ethical issue with this study is that Brendan's managers didn't seem to care about the issues with the software, possibly because they were dealing with convicts. Delaney said in an interview, "I was profoundly saddened and disappointed by the indifference of senior health department officials and investigators from New York City when I provided detailed information about serious flaws in the EHR software that could endanger patients. In all of the sources I found on this case, they only mentioned Delaney's managers in passing, although it seems pretty important to address the fact that they didn't want to do anything to address eClinicalWorks' faulty product." Following the news of a settlement, a majority of customers were found to have a more negative view of eClinicalWorks and in some cases electronic health record companies in general. Despite this sting on their reputation, eClinicalWorks has continued to exist as a company and has even procured new customers. They've continued to make advancements with their software and are still advertising their product. So it seems that the settlement has had little to no impact on the company's ability to grow. I think eClinicalWorks definitely deserved the punishment they got. I think more investigation should be made into the higher up at Rikers and the health department who didn't want to look into the issue. I also think the government should more closely monitor eClinicalWorks to make sure they are upholding the corporate integrity agreement and should keep monitoring them now to make sure that they aren't taking more shortcuts with their products.